Hello, everybody. Can everybody hear me? Let me know in the chat and we will go ahead and get started. Yes, awesome. Thank you guys so much. Thank you. All right. So, as always, hello and welcome, everybody, to another week of our ICD-10-CM Guideline Mastery sessions. I am Miss Haley. I'm going to be your lead instructor for this class, and I am so excited to welcome everyone to our Monday night class. We are going to be beginning our week 6. It's so crazy to say that. I feel like time is just flying by during this session. So, today we will be going over and reviewing some respiratory, integumentary, musculoskeletal, and urinary guidelines. I'm going to be using our ICD-10-CM guidelines and also referencing our MCG manual in this session as well. So be sure to have those both handy. And we are going to be doing things a little differently this class. We're going to try a different flow and we're going to be incorporating more review games. So instead of doing Kahoot, we're going to be doing a Jeopardy themed game as well as a Quizlet game to test our coding guideline mastery skills. I'm still going to stick with the same continued explanation and guideline referencing that we have been doing in the past sessions, so we can also use this video as a review tool in the future. So I'm going to go ahead and get started. As always, we have our copyright. So ICD-10-CM copyright 2026, American Medical Association, all rights reserved, fee schedules, relative value units, conversion factors, and or related components are not assigned by AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI Fab 7, AMCI ICD-10, FLIP, TAP, and MCG are trademarks of AMCI. The credentials of CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. All right. So after that, we're going to go ahead and jump into our first game. So I'm going to stop sharing my screen real quick so I can go ahead and grab our first game of the night. And we are going to be doing just, like I said, we're going to start off with a little Jeopardy game. Nothing too crazy. And I'm going to be referencing all of these guidelines are going to be coming straight from the MCG manual and using our ICD-10 guidelines. So that's how I found every single one of these questions. So that would be a good tool to be using for that, to do our game right now. So our categories that we're going to have, we're just going to be doing each chapter. So we have Chapter 10, which is going to be diseases of the respiratory system. We're going to do Chapter 12, diseases of the skin and subcutaneous tissue. Chapter 13, diseases of the musculoskeletal system and connective tissues. And Chapter 14, diseases of the genital urinary system. And I know I'm missing a chapter, but if you look in the guidelines, the digestive system, it says that it's used to further explain ICD-10 guidelines. So there aren't any specific guidelines in there. So that's why that chapter is missing from here. All right. And without further ado, we have a few questions. Hello, everyone that is in the chat. I'm going to go ahead and click away. We're going to go towards some of the easier ones up here. Let's start with Chapter 13, Musculoskeletal Systems, and make sure to put your answers in the chat. That's how we are going to be answering these, so make sure to put those in the chat. All right. First question. True or false? Code the bone, not the joint, Okay, here we go. Code the bone, not joint, for conditions near joint ends. An example of this condition would be osteoporosis and avascular necrosis. So, true or false? Code the bone, not the joint, for conditions near joint ends. I'll give you guys about 30 seconds. Put your answer in the chat. All right, amazing, amazing. I'm getting a lot of answers in there. And like I said, after this, I'm going to go over each question on here and I'm going to reference the guideline that I use. So if you need a little bit more explanation, I'll be going over them in the end. All right, so for this one, true or false, code the bones, not the joint, for conditions near joint ends. That is going to be true. That's going to be our first one. If you put true, amazing job. If not, practice makes perfect. And I will go into a deeper explanation after this. So no worries at all. All right, let's do another 100 one. We'll do diseases of the respiratory system for 100. A lot of these are going to be true or false. So this is our next one. True or false? For patients presenting with conditions related to vaping, assign code U07.0 vaping related disorder as the principal diagnosis. Yes, amazing job so far, guys. And like I said, I'm using just questions. I'm taking them directly out of the MCG manual with as far as the guidelines go. So that would be a great tool if you are looking for the answers with this. But I'll give you guys a few seconds to answer this one, true or false. All right, I'm getting some awesome responses in the chat. Awesome, awesome. So we are going to go ahead and it is going to be true. So yes, if a patient is presenting with conditions related to vaping, this would be the code you would assign as the principal diagnosis. Amazing job for everyone that put true. Great job. You guys are being super quick with it. All right, let's get a little more difficult. Let's go to a 200 question one. Let's do diseases of the skin. All right, another true or false. We're keeping it simple for our warm up. So, true or false, if a patient is admitted with a non pressure ulcer at a certain severity level that progresses to a higher severity level during their stay, only assign highest severity level during admission. So, just using one code, true or false. I know there's a lot of wording with this one, so I'll give you guys a few seconds. You got it. All right, I'm getting an astounding amount of responses for this one. So this one is actually going to be false. I knew this one would trick everyone up. Again, when it is false, I really am just using the wording from the guidelines and I'm only switching about one or two. But again, like I said, I will definitely go over this. So if anyone is confused, I will definitely go over this, why this is false after this. So do not fret. But there is amazing participation in the chat. Let's keep it up. Let's go for 300 diseases of the genital urinary system. All right. With whoopsies. With chronic kidney disease, what is stage 5 severity also known as? Is it known as A, moderate chronic kidney disease, B, renal disease, C, end stage renal disease, or D, mild chronic kidney disease? I know you guys got this one. I should have made this a little easier. I know you guys are going to get this one. Or I should have made it a little harder because I know you guys got this one. All right. Amazing job. I know you guys have been referencing that guideline that we were using a lot last week. So everyone got this one right. It is looking like amazing job. And it is indeed going to be C, end stage renal disease. So also known as stage 5 severity for the chronic kidney disease. Amazing job, everybody. All right, let's do another 300 since we're on a roll. So let's go back to diseases of the respiratory system guidelines. If it'll click on here. All right. Ooh, this is a lot of words. All right. So another true or false. So true or false. Acute exacerbation of chronic obstructive bronchitis and asthma refers to the worsening or decompensation of chronic respiratory condition. This does not imply an infection superimposed on the chronic disease, oh my gosh, chronic condition, although an infection may be a trigger. I know this is a long one, so I'll give you guys a few seconds on this one. And again, it is going to be true or false. Definitely pay attention to the wording. You guys got it. All right, so we will go ahead. Someone put C. Okay, let's see. This is going to be true. Amazing job. That one was a little tricky. That one was definitely a 300. That was definitely a difficult one for this chapter. So amazing job to those that got it true. If you picked false, that is okay. Again, practice makes perfect, and we will go over all of these, and I will be referencing the guideline that I used right after this. So yes, this would be true. All right, let's do another 200 one. Let's go back to musculoskeletal system. I feel like we haven't done that one in a second. All right. True or false? Category M81, osteoporosis with current pathological fracture, applies to patients who have a current pathological fracture caused by osteoporosis at the time of encounter. True or false? Category M81. I'll give you guys a few seconds. All right, amazing. I don't know why it's coming up on here that I'm muting my mic. I just don't think you guys want to hear my pregnant lady heavy breathing. So that's why I'm muting it a little bit. All right. So again, true or false, category M81, osteoporosis with current pathological fracture. This is going to be false. So the reason this is going to be false, again, with these, when it is false, I normally just change one or two things. And I know I wrote down the explanation, but I think the one thing I changed on here was the category. That's why I repeated it. I was kind of trying to give you thank you, Star Wars girl. I appreciate it. That is why I said this twice. So I believe this is everything about this wording is right. I believe the only thing I changed on here is the category. I believe all of this is right. It's just supposed to be category M80. But again, we'll go over that. But yes, I was just trying to be a little sneaky. This is the only Yes, so this is correct. I just changed the category. So yes, this would be false. But amazing job to those who got that right. Very investigative. M80, yes, correct. You guys are doing amazing. This is a great warm-up. All right, we will go back to another 100, diseases of the genital urinary system. Another true or false. Ooh, this font is so big. All right, true or false? Sequence CKD with diabetes or hypertension codes using notes in the tabular list. Is this going to be true or false? Give you guys a few seconds with this one. You are being super fast with your answer, so this should only take a second. All right, outstanding participation as always, everyone. So again, true or false sequence, chronic kidney disease with diabetes and hypertension codes. This is going to be true. So amazing job to those that got that one right. If not, as always, I know I've said it a million times, I will be explaining this afterwards. But this participation is absolutely amazing. I love that you guys are putting those answers in the chat. Great work, everyone. All right. Let's go for a 300. Let's do diseases of the skin. All right. Oh, why is that on? Hello. Oh no. Can I turn this off? All right. What category is used to describe pressure ulcers combination codes that identify the site, laterality, and stage of the ulcer? Is it E11, K50? I can't see these other two. Oh no. Well, I'll give you guys a hint since we can't see these bottom two. It's not E11 and it's not K50. So what category is used to describe pressure ulcers, which is a combination code that identifies site, laterality, and stage of ulcer? I guess we'll just make this a super difficult one. What category is used for this? You guys are already putting your answers in the chat. That is so impressive. Great job, Vina. You guys are adapting. This should be like a 500-point question, but you guys are killing it. Put those answers in the chat. Give you guys a few more seconds. All right. Indeed, yes. You guys killed this one. I didn't mean to, throw this difficult one out there, but you guys rose to the occasion. I know you can't see it right here, but all of you guys that put your answers in the chat and put L89, you would be 1,000,000% right. You guys, yes, I agree. You guys rocked it. Absolutely outstanding. Great job with this one, guys. I am quite impressed. You guys are really killing this warm up. That is awesome. All right. Since I threw a difficult one at you, we'll do this last 100 one to kind of balance it out. All right. Okay, we can see the whole one this time. True or false? If a non pressure ulcer is documented as completely healed at the time of admission, no code should be assigned. Is this going to be true or false? Give you guys a few seconds with this one. Good luck. All right, outstanding, outstanding. The answers are flying in. I just read that one. Amazing. It shows that you guys are using that MCG manual in your ICD-10 guidelines. So yes, indeed, everyone got this one right. It is indeed true. Amazing job, guys. That was awesome. All right, now we knocked all those out of that category. Let's do diseases of the respiratory system for 200. Yes, you guys are crushing it. This forensic coding is out of this world. All right. So, next one, true or false? Acute respiratory failure, or ARF, should not be coded as a secondary diagnosis if it develops after admission or if it is present on admission and should be coded as principal diagnosis. I know this is a long one, so I'll give you guys a few seconds to reread this one. Again, true or false? All right, all right. Everyone is putting false. Absolutely everyone put false, and it is indeed false. Amazing job, guys. I know I've said amazing like 800 times, but I am blown away. You guys are really looking at those guidelines, and it is showing. So, yes, it is going to be false. Outstanding, outstanding. We still got two left on our warm up. Let's do diseases of the genital urinary system. All right, this is another long one. True or false? For patients with a kidney transplant who still have chronic kidney disease, the chronic kidney disease itself is not considered a complication of the transplant unless there is documented evidence of transplant failure, rejection, or another specific complication. So, true or false? Give you guys a few seconds with that one. Everyone is putting in their answers so fast. Give you guys just a few seconds. All right, I'm getting some chat awesomeness going on. Those answers are flying in as they have been all night. So, in this true or false situation, this is going to be true. All right. So everyone's participation has been amazing. And like I said, I will go over every single one of these so we can know what guideline to reference if we want to go back and get some extra review. So for everyone that got that one right, absolutely brilliant. Yes, like Miss Olga said, brilliant indeed. All right, and let's end on a good one. Let's go for 300 diseases of the musculoskeletal system. All right. True or false? The seventh character D is used for encounters after the patient has completed active treatment for a pathological fracture and is now receiving routine care during the healing or recovery phase. And again, I'm using these straight from the MCG guideline book. So true or false? The seventh character. Give you guys a few seconds. You got it. All right, I'm getting a lot of trues. I'm getting a lot of participation in the chat. And you guys would every single one of you would be correct. It is true. What an amazing way to end this Jeopardy game. Nice job, everybody. All right. You guys absolutely killed that game. That was super impressive. I'm going to stop sharing my screen and go back and grab my PowerPoint presentation so that we can go over some of these questions just so you guys can really get some clarification if need be. All right. And here we are. All right. So how did we like that game? Let me know. Let me know in the chat. Did we like that review game? I mean, you guys did amazing at that game. I hope you liked it, but I know that regardless, you guys absolutely killed that review game. That was super impressive. Let me know in the chat how we liked that. And then while we're doing that, I'm going to go ahead and get started on the guideline references. So this was amazing. So this is going to be from the chapter 10, diseases of the respiratory system. So these are all of the questions if you guys need to, obviously this video is going to be recorded. So if you need to look back, these are going to be the answers, the question, the answers, and then this is going to be right here in the bold next to it is going to be the specific guideline that I referenced. So these ones, hold on, let me grab this real quick. All right, so the first one, pretty cut and dry. It's going to be for patients presenting with conditions related to vaping, code U07.0, vaping related disorder. That's going to be true. I believe pretty much everyone got that one right. So amazing job. The next one is going to be the acute respiratory failure should not be coded as a secondary diagnosis if it develops after admission or if it is present on admission and should be coded as a principal diagnosis. So this is false. Again, with these, I just change a few words. So this is going to be the guideline that I used, and the guideline states that acute respiratory failure may be coded as a secondary diagnosis if it develops after admission or if it's present on admission, but does not qualify as the principal or the first listed diagnosis. So I changed the not in here, I think is what I changed in there. So yeah, it was just a matter of, a few words changing. So I was just trying to be a little sneaky, but yes, this would make it false. In the guideline that I referenced, it says that it can be coded as a secondary diagnosis if it develops after admission. All right, and then the next one is going to be true. The acute exacerbation of chronic obstructive bronchitis and asthma, referencing to the worsening or decompensation of the chronic respiratory condition. Everyone got that one right again. That was super impressive because I feel like that was that was like a word soup in there. So that is going to be true. And then this is going to be the guideline that I am referencing for that one. All right, moving right along, our category 2, which was our chapter 12, diseases of the skin and subcutaneous tissue. First one, true or false, if a non-pressure ulcer is documented as completely healed at the time of admission, no code should be assigned. That is going to be true. True or false, if a patient is admitted with non-pressure ulcer at a certain severity level that progresses to a higher severity level during their stay, only assign highest severity level during admission. So this is going to be false. It is going to be false because it states in this guideline right here, if a patient is admitted with a non-pressure ulcer um, at a certain severity level and progresses to a higher certain severity level, you assign 2 separate codes. So right here, when it says 1 code, that's what would make it false. It's not 1 code. You would do 2 separate codes, and that's what makes it separate. So 1 code would be for the ulcer site and severity at the time of admission, and the second would be the site and highest severity level reached during the admission. So that's what would make it false. All right. And then the next one, what category, is to describe pressure ulcer combination code that identifies site laterality and stage. I was blown away that you guys got this one because we couldn't see all of the answers, but everyone got that one right. It is indeed L89, and this is going to be the guideline. All right. Moving right along. Our chapter 13, diseases of the musculoskeletal system. This one, true or false. You code for the bone, not joint, for conditions near the bone ends. Everyone got that one right. Amazing job. Next one, this is going to be false. I think this is the one that tricked a lot of everyone. Category M81, osteoporosis with current pathological fracture, applies to patients who have a current pathological fracture caused by osteoporosis. So yes, it was indeed, that is what I changed. So it's the same wording, but it is going to be category M80 instead of M81. So that's what made that one false. And then the next one, the 7th character D, being used for encounters after patient has completed active treatment. Everyone got that one right again. And then this is the guideline we are using. And then finally, in our chapter 14, diseases of the genital urinary system. This one's going to be true. Sequence chronic kidney disease with diabetes. The next one, kidney transplant with chronic kidney disease. This one's going to be true, and this is a guideline. And the chronic kidney disease, stage 5, end stage renal disease, which again, everyone got right. So absolutely amazing. All right. So after all of that explanation, and I know I went a little fast, but again, you can always look back through this video if you need to pause and look through those guidelines if you need some extra practice. And so we are going to move on to our next game. It is going to be a Quizlet game, and it is going to be incorporating scenarios. So I'm going to do 3 scenarios, and we are going to break them down. We're going to break them down by keywords, the guideline being used, and the codes that are going to be listed to code it. So we are going to get into some real detail with some scenarios. I am going to go ahead and stop sharing my screen and go ahead and grab that game. All righty. Let me share my screen and grab these flashcards. All right, so we are going to start. Going to do that. All right. Amazing job. Amazing. Okay. Can everybody see my screen? Let me know in the chat, and then we will go ahead and get started. And this obviously, while you guys are letting me know, this is obviously going to be our next game that we're going to be doing. So yes, thank you so much. So our first scenario is going to be Dr. Kepner diagnosed Mr. Jora with CKD, chronic kidney disease, stage 5, and ESRD. What ICD-10-CM keywords are reported? So what keywords are we taking out of this scenario? We're going to start with that, and we will move on. I believe that there are 3 that are going to be the answer to this one. So what keywords are going to be reported? What keywords are we going to be focusing on in this scenario? I'll give you guys a few seconds with this one, and good luck. All right. I'm getting some awesome responses in the chat. This is a great warm-up scenario we are doing. Everyone is killing it. Yes. So I'm going to flip this over. So indeed, yes, you guys absolutely nailed all three of these keywords. So yes, we would be focusing on the CKD, the chronic kidney disease, stage 5, and ESRD. Yes, spot on indeed. All right, so we're going to be focusing on next, we're going to be focusing on the same scenario. Dr. Kepner diagnosed Mr. Jora with CKD, stage 5, and ESRD. Oh, this isn't supposed to be keywords. Oh, so sorry. Okay, so yes, Dr. Kepner diagnosed Mr. Jora with CKD, stage 5, and ESRD. And now, instead of looking for the keywords, what ICD-10-CM guideline is going to be used specifically? I'll give you guys a few seconds with this one. I'm going to give you a hint because I know that we had some guidelines that kind of referenced this last week, but this guideline is going to be somewhere in chapter 14. Let me know what it is. I'll give you guys a few seconds. All right, amazing job, amazing job. If you're not sure how to answer, amazing job, guys. So yeah, so for this one, you could just name the guideline, or you can use if you want to use the guideline specifically that is, like in the MCG or the ICD-10, you can do that either way. I should have explained that. I'm so sorry. But if you put those guidelines in there, amazing job, guys. That is super awesome. So, yes, this would be indeed guideline IC14A1, which is chronic kidney disease slash stages of chronic kidney disease, CKD. I cannot say chronic today. I do not know why. That was super awesome, guys. I was not expecting all of that awesomeness, but I'm always flabbergasted by y'all. All right, so we are going to move on to our final part of this. So this is going to be, again, the same scenario. Dr. Kepner diagnosed Mr. Jora with CKD stage 5 and ESRD. But now we are going to put all of the guidelines and the keywords together, and we are going to do what ICD-10-CM code or codes are reported. Yes, you can put with those ones, you can put the title of the guideline, you can put the number that goes with the guideline, however you want to do it. I will pick up what you're putting down. However you want to do that, just put it in the chat. However you want to do it is fine. But I'll give you guys a few seconds with putting in that code or codes, and good luck. All right, outstanding job. If you are still looking for this code, go ahead. I am going to quickly stop sharing my screen and grab back our PowerPoint so that we can see how this looks all together. And then we will do 2 more scenarios just like this. So we still have time to go through everything. All right. Boop. Amazing. All right. So yes, so this is the scenario we were working on. So you guys killed this. The key words, the chronic kidney disease, stage 5, ESRD. Great job. You guys did a great job locating the guideline as well. So yes, we're going to be using this chapter 14, disease of the genital urinary system, and this is going to specifically be IC14A1. Chronic kidney disease and stages of chronic kidney disease. So right here, if you can see this guideline, it's going to state that, oopsies. It's going to state that when both a stage of chronic kidney disease and ESRD are documented, you assign only code N18.6, and you're going to verify the code selection, obviously, in the tabular list. So with doing all of that, we are going to, yes, and I see some people were using the I code. There is no hypertension. I know that you guys are focusing on those guidelines from last week, which is totally fine because we are still bringing up our chronic kidney disease. So I see where you are coming from. But for how to code this one, it is just going to be code N18.6, which is going to code for that end stage renal disease. And it even says right here at the end of N18.6 right here, the little tip at the bottom, when both ESRD and CKD5 are documented, code only for ESRD. So those are two kind of guidelines to point you in the right direction. But everyone did amazing. Everyone got that N18.6. So absolutely outstanding. And I love how it just beautifully comes together with this wonderful explanation. You guys killed it. I'm going to, again, switch back to our game so we can do another scenario. That was absolutely outstanding. I'm excited for the next one. All right, perfect. Okay, so this is going to be our next scenario right here. So our next, yes, great forensic coding. I agree. All right, so our next scenario is going to be a 73-year-old came into the ED with severe shortness of breath and goes into respiratory failure. He was intubated and admitted for acute respiratory failure. Chest x-rays show he has pleural effusion. So we are going to start from the top. We are going to pick, I believe it's 3, what ICD-10-CM keywords are going to be reported for this scenario. Put your answers in the chat. I'll give you guys a few seconds. All right, amazing job, everyone. You guys are killing these keywords. Great work, great work. So yes, there are going to be, and I guess you could, I see some people put shortness of breath. You could definitely put that as a keyword as well. The 3 that we're gonna focus on are going to be respiratory failure, acute respiratory failure, and pleural effusion. If you guys put any extra in there, I'm seeing some people put a few more, and I agree. Those could also totally be some keywords that could point us in the right direction. So amazing job all around. We are going to go to our next part of this. So again, same scenario. A 73-year-old came to the ED, severe shortness of breath, respiratory failure, intubated, acute respiratory failure. But instead of the keywords, we are again going to choose what ICD-10 guideline is going to be used in this one. I'll give you guys a few seconds and I'll even give you a hint. It is going to be a guideline from chapter 10. So with that being said, put your answers in the chat and I'll give you guys a few seconds on this one. Good luck. All right, if you put your answer in the chat, great job. If you are still looking through those guidelines, keep doing that. Amazing job. So yes, this is going to be from chapter 10. So the guideline is going to be yes. Specifically in the MCG, it's going to be IC10B1, but the title, amazing job. But the title, oh my gosh, the answers are flying in. The title of the guideline is going to be Acute Respiratory Failure as Principal Diagnosis. And you guys are killing it. Amazing for everyone that put that in the chat. Great job, great job. And to complete this scenario, again, we're sticking with the same one, but instead of choosing the guideline, instead of choosing the keyword, we are going to be choosing what ICD-10-CM codes or code are reported for this scenario. So again, 73-year-old came into the ED, severe shortness of breath, goes into respiratory failure. He was intubated and admitted for acute respiratory failure. Chest x-ray shows he has pleural effusion. So what code or codes are we reporting for this? And then we will go ahead and go over the explanation and kind of bring it all together. So I'll give you guys a few seconds on this one and good luck. All right, if you are still looking at this and solving it, go ahead. I'm not going to reveal the answer. I'm going to switch to the PowerPoint so we can go ahead and see how all of this looks together. So keep doing what you're doing if you are still solving. I'm already getting some amazing answers in the chat already. All right. Let's do this. Perfect. All right. So this is going to be our scenario. I won't read it again. I know I did it a million times, but the keywords, as we all put, amazing. So respiratory failure, acute respiratory failure, and pleural effusion are the ones that, or some of the ones that we have selected. And then this is going to be our Chapter 10 guideline, which is going to be acute respiratory failure as principal diagnosis, again, using those keywords. And so, according to this guideline, acute respiratory failure can be a primary diagnosis with another acute diagnosis if it is clear the respiratory failure was responsible for the patient being admitted. So, this would kind of guide us to use, like a lot of people put in the chat, to use a J96 code. And we do not have documentation supporting hypercapnia or hypoxia, like it says right here. So respiratory failure is going to be unspecified. So we're using two codes for this one. So our first code that we're going to be using, which a lot of you guys put in there, is going to be the J96.00 code, which is going to code for the acute respiratory failure, unspecified, whether with hypoxia or hypercapnia. So we're choosing, again, from this right hand little column right here. This is the one they're going to be using because it says acute respiratory failure. So that's why we're using from that category. And then, yes, we do also need to code for the pleural effusion. So, because it says checks Ezra's show he has pleural effusion, which is going to be another keyword that we chose in here, another thing to focus on. So, we do have to include that pleural effusion code. So, if you look at the ICD-10 alphabetic index, you will find that J90, and it doesn't need a fourth code. You can just code J90, pleural effusion, not elsewhere classified. So those would be the two codes. It would be J96.00 first and the J90 as the second code to code for the effusion. Does that make sense? I know a lot of you guys definitely got that J96 code. But does it make sense with the pleural effusion? Does that explanation make sense? I'm going to go ahead and share our last scenario of the night while you guys are letting me know in the chat. But that was amazing. I know. Yes. I know for me it was a lot harder, and you don't have the multiple choices on there to pick the code because, there's so many codes that you can pick from. So this is a little bit more of a challenging game to pick, but I feel like it definitely helps a lot more with, practice. So you can be definitely super confident when you do have multiple choice answers. Yes, Vina, you killed it. You guys did awesome. All right. And we are going to grab our last scenario for the night, and we will call it a night. So I'm going to go ahead and share my screen once more. All right. So this is going to be because the condition, okay, because it says not elsewhere classified, so that's why we're using J90 instead of J91. All right, let me see. Alrighty. But great investigative coding, guys. Amazing job. All right, so here is our last scenario for the night. Mrs. Willow, a 65-year-old, has developed a pressure ulcer on her right hip. The base of the ulcer is covered in eschar, and the provider documents that the stage of the ulcer cannot be determined. What ICD-10-CM code words are reported? I'll give you guys a few seconds for this one. All right. You guys are on top of these keywords, I swear. Amazing job. So, yes, these are going to be the three that we are focusing on, and everyone put these in here. Pressure ulcer, right hip, and stage of ulcer cannot be determined. Amazing start to our last scenario of the night, everybody. All right, and now let's move on. You guys know what we're doing next. We are doing our guideline. So we are doing same scenario with those keywords in mind. What ICD-10-CM guideline are we going to be using? I will give you guys a clue. It is going to be in chapter 12, the chapter 12 section of the guidelines with that skin and subcutaneous tissue. I'll give you guys again a few seconds with that one. I see a lot of people are already putting it in the chat. And I know we are running out of time, so I'll go ahead and flip this card. Oh, why are there just dots? That's weird. Anyways, but that is going to be the right answer. It is going to be the IC12A2, pressure ulcer being unstageable. Everyone got that one right. I don't know why it's not on here. But yes, everyone got that one right. Amazing job, guys. All right. And then last but not least, we are focusing on the same scenario. We are using those keywords. We are using that guideline. And what ICD-10-CM code is going to be reported for this scenario. Again, I'll give you guys a few seconds and then we will go over the whole thing. All right, if you are still solving, go ahead and continue. Again, I'm not going to reveal the answer just yet. I will go ahead and grab my PowerPoint so that we can go over everything as a whole. But we're already getting some awesome answers in the chat, so you guys just keep working on that. All right, so this is going to be our last scenario of the night. Oh, cool. Anyway, so our keywords right here are going to be the pressure ulcer, the right hip, and stage of ulcer cannot be determined. I feel like the stage of ulcer not being determined is kind of the really big factor in this one. So this is going to be the guideline we're going to be using, IC12A2, which everyone said. Pressure ulcer codes unstageable pressure ulcer. So I would like to, you guys, in this guideline, it definitely is, you have to notice right here that it says cannot be determined. So right here it says unstageable, that you use L89, a category from there, if the stage cannot be clinically determined. And then you would use unspecified ulcer, L89.9, a category from there, if no stage is documented. So again, looking at this scenario, it says specifically that it cannot be determined. So that is why we are going to go with the unstageable section of this guideline, and it's going to be the L89.0. The stage cannot be clinically determined. So if you go in the alphabetic index and you put two and two together, and you use the other guidelines with it saying right hip right here, and it's saying pressure ulcer, using all these keywords together. This pressure ulcer of right hip unstageable, which is code L89.210, is going to be the code that we are going to use to solve this one, which I believe absolutely everyone put in the chat. So that is amazing. That was a great way to end the night. Amazing, amazing, amazing. I've said it a million times, but you guys killed that. You guys killed that scenario. You killed all the scenarios. That was a great way to end our Monday night. And as always, I know I went a minute over. As always, if you want any more specification, if you have any questions, I know that we changed up a little bit of the flow of class, so I would love to hear your feedback with how you felt about it. I know that there were a lot more review questions, so definitely let me know how we can adjust this class so you guys can learn as much as you possibly can. I thought that you did absolutely outstanding. My wonderful team has posted the link in the chat, so make sure to give that a click and let us know how we are doing for the class. That was an amazing week 6, and I look forward to our week 7. Thank you for taking time out of your busy Monday to get some review in, get some guideline mastery in. You guys did absolutely amazing, and I hope that everyone has a wonderful rest of their week. And as always, we appreciate you. You guys have a great one.